The first exercise we'll go over for hip and knee rehab is a straight leg raise. For this exercise, you'll need to sit on a firm surface with your legs straight out in front of you. Once you're in the seated position, pull your toes towards your chest, turn your foot outward, and then slowly raise your leg off of the surface. You don't need to lift very high. You can lift just about 6 to 8 inches, and that should activate the muscle. This exercise is intended to activate the medial quadriceps muscle. So that's where you should feel the majority of the muscle contraction. If you are not feeling the contraction in that medial part of the quadriceps, try rotating your foot inwards or leaving it in a more neutral position, but still maintain the toes up position. Make sure to test this exercise on both sides so you can see how your muscles contract from one side versus the other. The next exercise we will go over is a glute bridge. For this exercise, you'll need to lay on your back on a firm surface. Then bend your knees to about a 90-degree angle. From here, you will then squeeze your glutes or your butt muscles together as you lift your hips towards the ceiling. As you do this motion, be sure to feel that your glute muscles are actually firing and contracting. A lot of times, people have issues contracting their glute muscles, which results in them using other muscles to compensate for their weak glutes or inability to fire those muscles. You can continue repeating this exercise. In order to change this exercise to activate your hamstrings, simply walk your feet further away from your hips. Our next exercise is called an isometric contraction. This exercise will focus on the external rotators of your hip, and you'll need a towel, a sweatshirt, or some other pliable object that you can place between your knee and the wall. You'll place the object between your knee and the wall, get into a kneeling position, and push your knee into the towel or object. You'll then hold that contraction for approximately 10 seconds. Once you've reached 10 seconds, you can relax but maintain this position. Then you will repeat the same muscle contraction again. You should repeat the isometric contraction anywhere between 3 to 10 times per side. If your knee that's on the floor is uncomfortable, try placing another soft object underneath to give you a little bit of cushion. Now we will go over the fire hydrant exercise. For this exercise, start in a standing position with your feet together and knees bent slightly. I would recommend doing this against a wall so that you have something to help stabilize you and maintain your balance. You will lift one leg out as high as you can, keeping your hip from rotating so that we can make sure that you are firing your glutes. Again, you can feel for the muscle contraction. You will likely also feel a muscle contraction and some firing of the muscles on the stance leg as well. Again, try not to rotate your moving leg outward or inward as you go through this motion. Keep it as straight and in line with the other leg as you can. Next, we will go over a squat to sit. For this, you'll want to have a firm, stable surface behind you to reach for as you squat down. This surface can be as low or as high as you feel comfortable moving to. One key component to this exercise is to push your knees apart from one another so that you can make sure they are not going to collapse in and cause your knees to come together. Once you are ready, go ahead and squat down. Try to make sure that your weight is evenly distributed and you are not leaning to one side or the other. You can either squat and assume a fully seated position, or squat and simply make contact with the chair or bench that is behind you and stand back up. Once you have progressed your squat enough, you can attempt a mini single leg squat. Again, you will want to have an object behind you, such as a chair or bench that does not have wheels or roll, and you will want to reach for that object. You will squat down with one leg and then use both legs to help yourself stand back up. Again, try to make sure that your knee is not collapsing inwards towards your other leg. You can prevent this by pushing that knee out intentionally before you start your descent. You again can either sit completely down on the object or simply make contact and then stand back up. In order to perform a hip flexor stretch properly, you'll want to assume a kneeling position. It's really important for you to pay attention to your pelvic positioning here. Notice how I was able to rotate my pelvis so that it is flatter and less tipped forward at the front of my hips. This will allow me to activate my glute muscle a lot better. When you fire your glute with your pelvis in a neutral position, your body will automatically stretch your hip flexor for you without you having to lean forward very much. So it's very important for you to be able to have the pelvic control in order to move your pelvis in a way that allows you to fire that glute muscle, which will result in a hip flexor stretch. Next, we'll go over a figure 4 stretch. This stretch you will feel deeper in your butt. It's stretching the muscle called the piriformis. For this stretch, you will lay on your back and cross your ankle over your opposite knee. Then you will pull from behind your knee towards your chest. You should feel the stretch here. If you do not feel a stretch here, you can use your hand to apply more pressure on the knee of the crossed over leg. You can do the stretch on both sides, even if you're only having pain on one side. Stretches should be held for approximately 30 seconds to 2 minutes each time you do the stretch. This last exercise is called a Z-sit or 90-90 position because your hips and knees should remain at 90 degrees at all times. Notice how my front leg, my thigh is completely perpendicular to my back leg. Then my knee is also bent to a 90-degree angle on both legs. You can perform multiple stretches while in this position, as I am demonstrating here. You will feel these stretches in different areas based on the angle that you are leaning forward or backward. You can also sit in this position as you perform other tasks throughout the day, such as watching TV, reading a book, or working at your computer. It is really good for you to be able to switch your sitting position throughout the day, especially if you spend long periods of time in a seated position. This 90-90 or Z-sit position is a great way that you can multitask by working on your hip mobility while you accomplish other things. Be sure that you attempt the Z-sit or 90-90 position on both sides and take note and compare how one side feels versus the other. Typically, one side will feel much tighter, which means that you should probably spend some more time working on your hip mobility on that side compared to the less tight side. but be sure to give them equal attention as well.